Well, hello, I'm Michelle Chadwick and I'm the founder and director of Hypersomnolence Australia. I'm also the chairperson of Sleep Disorders Australia. Welcome to our second special presentation. This one is about cognitive behavioural therapy for hypersomnia. Dr. Sara Winter is a clinical psychologist with over 15 years of experience and has a special interest in sleep disorders and chronic disease. So I will hand you over to Sara now. Don't forget, if you have any questions, to pop them in the chat and we'll get to them at the end of the presentation.
Thanks, Michelle. And hi all, thanks for the invite. I'm really happy to talk with you tonight. Some of you may have attended the Hypersomnolence Education Day last year, and if that's the case, my apologies, there might be a bit of an overlap. So some revision perhaps. But also I wanted to talk to you about some sort of future research we're wanting to do in the CBT-H space. So keen to get your thoughts and ideas on that and potential interest with it, if you'd like to participate in some of that research as well. I'll just share my screen. So hopefully that's coming up okay. So you can all see the slides, is that right?
Yeah.
Yeah, okay.
Yep.
All right. So CBT-H, you might have come across the idea of CBT-I, which is cognitive behaviour therapy for insomnia. It's a really evidence-based intervention for insomnia. It's been around for yonks and very well validated. CBT-H is much newer. So I wanted to talk to you about sort of some of the background to that and what we're doing with it. So I guess that's this cognitive behaviour therapy for hypersomnolence. The purpose of that is to sort of come at coping with living with hypersomnolence conditions. So, the narcolepsy type 1, type 2 and idiopathic hypersomnia is sort of the ones particularly we're looking at and utilise this intervention for. But also I have used principles from this with people that have other, sort of hypersomnolence issues, such as, living with chronic pain or perhaps sleepy on CPAP, that sort of thing. But it's been developed specifically for the central disorders of hypersomnolence. So this is the stuff that we do in this intervention, and I just wanted to, I guess, give you a bit of a sample of, some of the things that we cover. But the broad domains is we want to look at sort of cognitively, which is around sort of thinking. So kind of thoughts and perceptions and beliefs about your self-world and the future in the context of living with a hypersomnolence condition. But also other cognitive aspects, things like brain fog and, the cognitive consequences from a processing standpoint. Behavioural, so, the behavioural things that are impacted by living with a central disorder of hypersomnolence. And perhaps some tips and strategies for energy management. Interpersonally, so some sort of assertiveness and sort of considering the social aspects of conditions. And a big theme throughout CBT-H is around acceptance, which doesn't mean liking or wanting, of course, living with a chronic condition. But, with that attitude of acceptance of the reality of the circumstances, I guess that gives us some options for effective self-management and moving forward. So I guess I just wanted to reflect with you, what does it mean for you to live with a hypersomnolence condition? Many people can sort of identify a real sort of pre-hypersomnolence and post-hypersomnolence life. Often, of course, the development and onset of the symptoms is quite insidious. It happens over lots of years usually, but often people do have sort of almost like a pre-morbid state when, you know, felt pretty okay. And then I guess what life is like now. And if we think about the way in which identity and the way in which you see yourself shifts with that, that's quite normal and okay and to be expected. But again, I guess if we're coming at it from that acceptance perspective, we've really got two options there really is, you know, we could refuse to accept the reality of, you know, living with a central disorder of hypersomnolence and keep trying to do things the way we've always done them, live life the way it used to be. Our other option is on a path of acceptance, which, you know, as I said, doesn't mean liking it or wanting it, but it does mean looking at your options and perhaps thinking about what might be the most effective way to live a rich, full and meaningful life moving forward with this condition. So the research tells us quite a bit about the quality of life impacts of the central disorders of hypersomnolence. I'm sure none of this surprises you though, of course, having that lived experience. So we know that health-related quality of life is significantly reduced for people if the hypersomnolence condition compared to the general population. There's 2 to 3 times the rate of anxiety and depression disorders diagnosed with people with hypersomnolence conditions. We know that even when people are treated with pharmacotherapy, so perhaps things like a stimulant, quality of life is lower compared to matched controls of the general population. We certainly know pharmacotherapy can help, has sort of variable benefits, of course, across people, but we know it doesn't do the full job in terms of, you know, the quality of life impact. We know that there's more medication use, just sort of generally across the board for things like often other common comorbidities, things like depression and anxiety, things like chronic pain often are comorbid with the hypersomnolence conditions and so on. And relationship conflicts can be a challenge. So I'm not sure how much of that sort of resonates with you, and perhaps there's impacts that I haven't listed there that come to your mind. So certainly this isn't an exhaustive list. So we know living with these conditions is a really big deal. It has really wide-reaching implications for your health and well-being. Anecdotally, so this isn't necessarily from the research or the literature, but having worked with lots of people with hypersomnolence conditions, these are the things that sort of strike me, that I find that many people, particularly with the IH, have a much more variable sort of response to medications. And, you know, I'm not sure whether that's just, you know, kind of the experience I've come across, or whether that's sort of borne by the literature in that domain, but that seems to be something I see a lot. So having to have other strategies for living life is really important. Often there's a stigma with idiopathic conditions generally. So I guess idiopathic is sort of that pocket where, you know, we can't really quite put our finger on why this is happening, but we know it's happening, basically. And for that reason, because it's sort of idiopathic, often people have gone through quite a lengthy, invalidating often process around investigation and diagnosis and misdiagnosis and so on. So there can be quite a lot of just health-related trauma. I find, you know, as a psychologist, that's something that I can see is sort of, you know, how do we deal with all the sort of negative experiences that have happened up until this point. It can be tricky to navigate community supports, things like NDIS and the disability support pension, whole minefield there in terms of what they will and won't recognise as disability and level of disability. It can be really challenging to meet the practical aspects of life. Often there's financial disadvantage because perhaps you can't work full-time, or you have to have adjusted hours and so on. And often there's, as I said, lots of other comorbidities. So there's lots of complexity there to deal with. Now, just some useful websites that I've come across and happy to endorse. You all clearly know about Hypersomnolence Australia because you're here. But you know, there's some really good services and resources and things to find on the internet. And I'm really pleased all of you are linked in with sort of a support group. I think that's really important. Okay, in terms of, you know, some of the key messages when we're working on a hypersomnolence condition, so the CBT-H. Interestingly, so the program that we've developed, our CBT-H intervention, which I've refined over the last couple of years, is working with patients and clients. There's 6 sessions, and really 5 of the 6 sessions is not about sleep. So we touch on sleep, and of course there's things that we want to work on with sleep, but actually it's much more focused on living life, the wakeful period, and how do we make the best of that. But from a sleep perspective, I guess there's a few things to note. The way I guess I conceptualize a hypersomnolence condition is that your sleep is inefficient. So theoretically, you could sleep and sleep and sleep and sleep and still be sleepy. So we know that sleep's not doing the full job of kind of the restorative effect that it's meant to. So I guess from that perspective, so that we've got time to live life during the wakeful time, we want to try to find a balance between quality and quantity of sleep. So we know it's not just a quantity thing, because otherwise, you know, if you got whatever the quantity is that you needed, you'd be fully refreshed. So we want to make sure, you know, often people with IH in particular are longer sleepers dispositionally. So we do want to make sure there's an adequate opportunity for sleep, and that we're trying to maximize that sleep and protect that sleep as much as possible in terms of our lifestyle and routines. But as I said, I guess we want to also have the wakeful time too that we want to be managing. So in a perfect world, we'd be up around the same time every day, and we'd go to bed around the same time every day. If there was one thing to be really strict on, I would say it's the wake time. So sometimes life happens. Sometimes you might get a bit sleepy earlier. Sometimes you've gone out and, you know, you're doing something that's important to you, and you're willing to, you know, kind of on that occasion, go to bed later. I guess, you know, that happens, and that's fine. If you could still try to get up around the same time every day, we've got a nice anchor for your circadian rhythm, and can kind of then help your body to sort of keep up that pattern of trying to get the best quality sleep that it can. Experimenting with napping is something to consider. So with someone with insomnia, that's something we wouldn't recommend. So we'd kind of do whatever we could to try and keep them up and to not nap. Whereas napping is actually a really key recommendation with the hypersomnolence condition. What the research indicates is that brief naps are more effective than the longer naps. Not for everyone, of course. So none of these recommendations are going to be kind of match everyone. So it's worth experimenting to see what happens for you. But for most people, a brief nap of about 15 minutes, say mid-morning, mid-afternoon, it's like a little zap of the battery to help you sort of get through that next portion of the day. Okay. Just another thing we really want to think about with living with any sort of chronic condition is having realistic goals and feeling successful and efficacious. So I like this SMART acronym for goal setting. potentially you've come across it in other contexts. It's certainly not new or unique. So a lot of businesses, you know, talk about SMART goals, project management, for instance. It's SMART just stands for specific. So, you know, specifically, what do you want to achieve? How are you going to measure it? How do you know it's been achieved? Is it attainable, as in realistic? So I guess I was talking about before that difference between kind of pre-hypersomnolence and then post-hypersomnolence life. If we're setting goals that are that match with what life was like before, that aren't so congruent with the reality of how things are now, then perhaps it's not going to be attainable, which is then going to impact on your sense of efficacy and achievement. Relevant. And I guess I would argue of this SMART acronym that R is maybe potentially the most important part. Anything that you're deciding to do with the precious energy that you've got, your energy is a precious and limited resource. What are you going to choose to invest it in? There's perhaps lots of things that, you know, people tell you should do or society thinks you should do, but actually what's most important to you, what's most relevant for you, and thinking about your energy as an investment in that standpoint. So, you know, you could set lots of goals, but actually if it's not stuff that's of high value to you and really important to you, I guess I'd get you to reflect on that, whether that's the path you want to go down. And time-based. So sometimes it's worth breaking things into sort of smaller portions. You know, what am I going to do this morning? Or, you know, what do I want to achieve by the end of today? Or, you know, if I've got a bigger thing that I want to achieve, how can I break it into smaller portions so that I can sort of, again, have that sense of efficacy and control? I can kind of tick it off and say, yes, I've achieved that, and on to the next thing. The Pomodoro technique. So I'm told I pronounce this incorrectly. I pronounce it like an Australian. Pomodoro is Italian for tomato. So it's, I guess, supposed to be like pomodoro or something like that. But if you think about a tomato and slicing up a tomato, so slicing up your day is sort of essentially the idea of the Pomodoro technique. It's similar to the idea of the spoons theory in sort of the chronic fatigue sort of practice space, with some tweaks to it. But I guess the basic premise of the Pomodoro technique is if I've got a pretty consistent wake time and bedtime, then I can predict pretty accurately how much then wake time for the rest of it, you know, the rest of the day. And then again, if my energy is a precious and limited resource, it can feel pretty overwhelming to think, how am I going to get through this entire day now? Whereas what would it be like if we sliced up the day into smaller segments? So it's about choosing how I'm going to use each of these slices in terms of, you know, my behavioural choices and activities and goals. Now, there's no right or wrong there as to how you might slice up the day. So some people might slice it up into really tiny segments, like every half an hour. Some people would slice it into sort of a morning, afternoon, evening, so kind of bigger slices. Probably what's most common that I see is people kind of slice it into sort of 2 to 3 hour kind of increments. So there might be like a waking increment, maybe like a post-breakfast, mid-morning increment, then a before lunch increment, an after lunch increment, mid-afternoon, pre-dinner, and so on. But, you know, there's no right or wrong there, except that it makes sense for you. So having a think about just what would make sense in terms of slicing up your day. You know, if you were to think about it as smaller segments, what would be kind of each hump? What would it look like? And another thing to consider there is your sleepiness and energy and how that tends to fluctuate during the day. So of course, no day is going to be exactly the same, but most people can kind of identify a little bit of a pattern. There's some predictability to it, particularly if you've got that consistent wake time and bedtime. I can pretty guarantee that I'm going to wake feeling pretty, there's a lot of sleep inertia. Then I might pick up for a bit, and then I'll dip down again after lunch, and then and so on. So again, everyone's a little bit different, but just sort of thinking about how does yours almost from a circadian, like just sort of a body rhythm perspective, how does your energy tend to fluctuate? And if we were then used to use the Pomodoro technique and slice up the day in kind of portions that make sense based on that, then that kind of helps us to make some, useful behavioural choices. So for instance, if we just have a look at this slide, this dotted line is just sort of your average energy. So not comparing yourself to anyone else and not comparing yourself to the general population. So for you, what's your kind of baseline energy, like your okay kind of energy? Then this squiggly line could represent a hypothetical way in which energy might fluctuate during the day for someone. So let's say this person, so can you see my my mouse, my sort of cursor there? Or
yes.
Good. Okay, so I'm not just pointing to myself. Excellent. So this person starts pretty, then they kind of pick up a little bit to about average. They dip a little bit. Then they sort of middle of the day-ish. They're feeling either pretty okay or sort of average, but that tends to be, sort of their best, most productive time. Then it kind of drops off a little bit before kind of dipping, in the evening. So this might look nothing like, how your energy fluctuates, but just for illustration purposes. So if we can predict this a little bit, ideally what we'd want to be doing is things that sort of for us are associated with nurturing or picking up our energy a little bit during these slices when energy is a bit lower. So having a think about for you, what are the kind of things that tend to boost your energy? And when I say boost, not as in like, wow, like I feel amazing, but it sort of picks you up maybe a bit closer to sort of okay or average or less awful, maybe. Common things would be medication. So perhaps, medication is, part of your strategy. Perhaps medication is a morning strategy rather than an afternoon boosting strategy. So timing is important from that perspective. Getting up and having a bit of a move around, having a shower, getting light, having something to eat or cold drink, are sort of, common things that people describe. Engaging with people with whom you feel liked, respected and appreciated. There's some people where having something to eat really just leaves them feeling really flagged. And so, of course, everyone's different there. So just get you to reflect on for you, what are the kinds of activities, places, people that tend to give you a little bit of a boost? And strategically, if we can try to insert them in at those times and we know it's going to be flagging a little bit, that can be a bit of a useful strategy. And similarly, if there's times where energy's feeling okay-ish, that might be when you choose to do the things that are a bit more physically or cognitively effortful for you. But what I don't want you to do is smash yourself during that time either. So we kind of want to set smart goals with that. But for instance, for this person, it would make sense that if they're a worker, for instance, they might try to schedule in meetings that are a bit more challenging or work tasks that require a little bit more sort of cognitive attention during those times. And then perhaps during those other times when energy is flagging or tends to be flagging, they might schedule in a few more movement breaks or, sort of self-care activities and maybe do more of the work tasks that are a bit more maybe just sort of automatic or procedural, ones that aren't quite so hard for them. Of course, there's times in your day where you're feeling okay. And so, where you're feeling pretty neutral, and there's lots of neutral activities that we have to do in our day too. Unfortunately, a lot of our activities of daily living are the depleting, sort of energy draining activities. So I guess we do want to think about if I have to do them, when am I going to do them? Can I break them down? Can I outsource some things if that's at all possible, of some of those things? What can I do to insert a few more of the nurturing, boosting activities in? So I guess what we want to do is have a little bit more of a balance of the nurturing and depleting in there. And I'm not suggesting the nurturing activities have to be stuff that lasts ages. It could be brief, sort of bite-sized things like getting up and having a wiggle or having a stretch or going for a brief walk or whatever. But that I'm kind of thinking about inserting that in my day. Commonly, living with a condition where sort of energy is low and sleepiness is high, it makes sense that there might be a reduction in behaviour. And part of that is going to be realistic, right? You might not be able to be as active as previously. I guess it's a bit of a balance though. We want to still make sure that we're getting some opportunity for reward, pleasure and socialisation that's realistic for you, if we set smart goals around it. So again, I'm not sure how sort of familiar these sort of cycles look to you, but if we think my energy is low, perhaps I do less things. And usually what most people would do is keep up the things they absolutely have to do, which would tend to be the depleting things, but we have to still try to function. What often drops off is the pleasurable or social things. That can lead to some social isolation, reduced opportunity for reward and pleasure, and bring your mood down. So it can become a little bit of a self-fulfilling prophecy there. Everyone's needs are a bit different there. Some people are really gregarious and social, other people are more introverted, but all of us are going to need some kind of social contact on some level. And what does that look like? And how might you get those needs met in a realistic way? And similarly, perhaps you need to find new activities or new pleasures that kind of having to think outside the box, because perhaps some things that you used to do just aren't sort of realistic anymore or kind of require too much energy. So I guess what we want to do is try to reinforce this kind of cycle that, and the intervention point is around here. So we want to try to up the nurturing activities as much as we realistically can, increase opportunity for social connectedness in a way that suits you, which is going to help reverse some of that mood spiral. And I guess if we're looking after our mood, it's sort of going to sort of help with energy to some extent. So at least we're not getting the overlay of depression bringing down energy as well as the hypersomnolence condition. Just try to manage the mood so we're kind of still got the hypersomnolence condition to manage. So as a bit of an easy reference, I like to think of this behavioural activation equation. So as a rule of thumb, every day, trying to have a think about trying to get at least one social interaction in with someone with whom you feel liked, respected and appreciated. It doesn't have to be like a big thing. It could be sending a text, could be a brief convo, could be, none of these things have to take a lot of time, but every day if I interacted with someone in the world, I've had that invisible thread that's reminded me I'm not alone. At least one mastery or achievement activity every day. So these might not be things you necessarily enjoy doing, and perhaps they might be depleting. They might fall in the depleting category, but I feel really pleased that I've done it. And because I set it as a SMART goal, I was successful. I achieved it, which helps you to feel good. And at least one pleasurable activity every day. So at least one thing, just because. It doesn't have to achieve anything, although if it does, that's a nice bonus. But just because you deserve to have fun and pleasure in your life as well. Okay. From a social interpersonal perspective, I guess there's lots of things to consider. Some people find it useful to communicate with others and their employers, for instance, their social networks that they're living with a hypersomnolence condition. There's definitely pros and cons. around that. And I'm not an advocate for one way or the other, except that it sort of suits you and works for you. I guess some of the benefits of disclosing to others that you have a hypersomnolence condition is, perhaps they can have some realistic expectations, perhaps they can support you, in the work context, for instance. Work can make reasonable accommodations for you so you can be efficacious in your job. Cons can be potential stigma, for instance, and it's a really sad reality that there is stigma. There shouldn't be, and it's wrong. But there are people that I've had to advocate for people to their workplace, for instance, around reasonable accommodations, for example. So I guess being willing to be an advocate for yourself and having a team of sort of health professionals that can advocate for you as needed. You certainly could choose not to tell work, for, if we kind of just use that example too. And there's pros and cons around that. So I guess some take-home messages so far. Have a think about your energy. How does it fluctuate during the day? And having a think about how I might slice up my day into smaller chunks and kind of be a bit strategic, a little bit clever about when I'm going to insert things in the day. You're thinking about, do you need to be assertive around your needs in the workplace or with your support network, with your family? So having realistic expectations. Have a think about whether you can increase nurturing activities, even brief bite-sized ones throughout your day. Just wanted to touch on hyperarousal. So this is a really sneaky energy drainer. You might have come across sort of the idea of the fight, flight, freeze response. So when we're stressed and when our nervous system's activated in response to a perceived threat, we wind up so that we can deal with that problem. It's psychological and it's physiological, so that sort of, busy mind as well as sort of a wound up body, it may be feeling chronically stressed. Now, for brief periods of time, it's really adaptive for us to wind up in response to a threat. If I'm faced with an immediate problem that I need to get in, particularly if it's around survival, then this activation is really helpful. But when it's chronic, when it's carrying on, that's really fatiguing for our nervous system and it will really drain our energy. So I guess if there are some chronic stressors in your life, perhaps sort of thinking about and evaluating those, are there any things that you're willing to let go of, as painful as that might be, for example, if it's something that's sort of, winding you up with nowhere to go. Some things are worth it. So some things you might be worth to sort of expend energy in this way because it's of such high value to you. So if we come back to those SMART goals, if it's something that's highly relevant that are set, then, you might be willing to pay that cost, and that's okay. Something just to have a think about is the difference between sleepiness and fatigue as well. So that's something that often people kind of struggle to differentiate. So fatigue is that sort of chronic, sort of exhausted sort of feeling. Now, sleepy is more like I could nod off at any second kind of time. Often people with hypersomnolence conditions are both, but at different times of the day, one might be more predominant than the other. So that can kind of help us in terms of the choices that we make behaviourally if we're then thinking about that energy fluctuation. So for instance, if I'm feeling sleepy, that's more of a sleep need kind of thing. That's when a strategic brief nap actually might be really beneficial. If this is more that I'm fatigued rather than I could nod off to sleep at any moment, that's when perhaps, connecting socially or doing something pleasurable, or kind of just getting out of the context that you're in for, you know, a brief time and stretching your legs and getting some sunlight, or doing some deep breathing or relaxation or whatever it is. So I guess just what I'm suggesting there is if we can kind of identify some of the signs of each of them, often it you know, the management choice is a bit different. So if I'm feeling fatigued, a brief nap's probably not going to do all that much, whereas when I'm sleepy, it will, and vice versa. All right, so just a little bit of a look at your nervous system. So just a brief sort of, you know, psychophysiology 101. So your brain and your spinal cord, your central nervous system. Everything outside of that's your peripheral nervous system, so all the nerves to your skin, tissue, organs, and so on. Under that peripheral nervous system, the autonomic division is all the stuff that happens automatically. So you don't have to tell your heart to beat, it just goes ahead and does it. You don't have to tell your adrenal glands to activate and release, you know, adrenaline and so on. It just happens. So when something is perceived as a threat, it will activate that sympathetic branch of the autonomic nervous system. It'll wind us up, which, as I said, for brief periods of time, really useful. On a chronic basis, really knackering for your body. What we would like to do is try to be in this parasympathetic state, you know, particularly around our wind down and sleep time, you know, in order to get the best bang out of our buck that we can for sleep. We want this nervous system to have wound down. So I guess I just wanted to sort of plant that idea with you, give you that perspective. So self-care is a really important part of coping. Have a think about your energy boosting and calming activities and when you might use them and how you might schedule them in your day. I guess the eventual aim is to have a pretty consistent routine. And again, that's not always going to be perfect and not always going to be realistic, but if most days I can kind of have a bit of, you know, sort of a routine around the things I do to take care of myself, often that can kind of lead to a little bit more resource for you during the day. Just having a think about our thinking. I'm just looking at the time. I know I've been really banging on, so I'll try and get through. I guess ultimately we'd like to try and think in self-compassionate, helpful, realistic ways about ourselves and the world in the future. So just some helpful thinking prompts, you know, when, you know, you're evaluating life and, you know, your day-to-day circumstances. There's lots of different things that you could ask yourself. The one that I like the best personally, so I use this with myself because, you know, I'm a psychologist, but I've got my stuff too. We all do. We all sometimes need to kind of, you know, evaluate what we're doing and what we're thinking about things. So I like this one. And as a psychologist, I give advice all day long. Most of us are pretty good at giving advice, but not so much taking it. So if I just stop and say, okay, Sarah, you know, what advice would I give to someone else here? That can often help me sort of shift out a bit of a negative perspective on something. Even if the advice is, you know, you have to let it go. Get over it, Sarah, or whatever. Okay, mindfulness is another thing that we can use as sort of part of the program. So mindfulness skills are really evidence-based across, you know, a variety of health, chronic health and mental health conditions. You know, it activates your parasympathetic nervous system, which was that rest and digest arm that I was talking about before. They're portable. So, you know, really mindfulness is just about attention management. So you can be mindful of anything, really. You know, you can be mindful right now of your feet on the floor and your body in the chair and my voice. When you're in the shower, you can be mindful of the water on your skin. When you're out having a walk, you can be mindful of the sights and sounds and experiences that you're having. By deliberately focusing attention in the moment, it's really regulating for our nervous system. If I'm reducing that arousal in my nervous system, it's actually reducing some of the drain on my energy. So I guess that's the, you know, the outcome can be that I've got a little bit more energy for something else that's important to me. Another thing that's really useful about mindfulness is it can be used as a way to kind of get out of a negative thinking loop as well. Now, if I, for instance, am ruminating on something, it's going over and over in my mind, and I put my attention to my breath, for instance, I'm just reminding my mind to just notice and let go of that thinking. So mindfulness can be kind of useful from a couple of perspectives. So practice mindfulness in lots of different ways. There's lots of different, just YouTube, you know, have a play around with some mindfulness things. There's lots of apps like Calm and Headspace and so on. It's not for everyone, and that's okay. So I guess I'm just sort of giving a bit of a sample of things that you might want to try, take them or leave them, and that's okay. So again, a few take-home messages: engage in helpful thinking about your condition and your coping, trying to be self-compassionate as much as possible. Have a notice if there's any unhelpful thinking going on and whether, you know, that's something that's useful to you and whether you want to shift out of it. Mindfulness can be great for acceptance and for calming. I guess there's lots of implications, as I've said, with living with a hypersomnolence condition in school and work, with medications and with driving. As I said, I think it's really important that you have a team around you, so at least a really good GP who's across this or a sleep physician, but also you might have a psychologist, for instance, or a really good personal trainer or physio or someone who kind of understands the condition, for example. Okay, so thinking about advocating ourselves, strategies to maximise your functioning in the context of living with this condition. There's no magic wand that's going to kind of fix everything, but, you know, how can we live the best life we can with this condition? Okay, so this is my last slide, and then I'll zip it and let you guys ask stuff that you want to. Where to from here? So the CBT-H program actually was initially like a pilot was done of a CBT-H program in the US by Jason Ong's group. So Jason Ong is a sleep researcher who does a lot around mindfulness-based stuff, and hypersomnolence is some of the key things that he does. What we have done is sort of take and sort of refine that CBT-H intervention over the last couple of years. So with people that I've been working with publicly and privately, and sort of shifted things around and kind of developed it and beefed it up and stuff. We're at the point where we'd really love to start to co-design it with sort of, you know, stakeholders, with you guys with lived experience. So what that might look like is in the future some focus groups kind of going through the intervention, not kind of looking at what bits are useful to you, what bits aren't, you know, what do you think we should do more of, what do you think we should do less of, what do you need, basically. Then the next step would be a randomized control trial. So we actually want to test it and check that it works. You know, does it help? So we know it's not going to cure hypersomnolence, but what we would hope to see is improvement in coping, self-efficacy and quality of life, perhaps a reduction in sort of mental health measures around depression, anxiety and stress, for instance. So we want to kind of test it out and, you know, make sure this is an effective intervention that helps people. And then the final step would be that we kind of create something that can be just accessible to all. So perhaps like a digital platform or like a self-help kind of thing where, you know, people can take and use the resources and develop their own sort of self-coping strategies from it. So that would be the eventual aim. All of this requires lots of bureaucracy and ethics and stuff, so it's not like a right now kind of thing, but we're hoping potentially, you know, in the next, you know, sort of maybe 6 months or so, we might get to the point where we're kind of putting out a call for people to come and do some focus groups with us to help co-design and refine the intervention. So just sort of wanted to flag that with you, and I hope it's okay if at that time we might ask Michelle if we can kind of send it around to you, and no pressure, you know, you certainly don't have to, but if that's something you would like to get involved in, we'd be delighted to have you. Okay, so I'll stop sharing. So can you still see me? My screen looks blank.
Yep.
Yep, sure can.
Yep, I can. Thank you very much, Sarah. I look forward to helping you with your co-designing your study, and I'm sure that there'll be many other people that will be interested as well. There are quite a few questions here. I'm going to hand it over to Susie to start asking those, but just before we do, there's one at the top of my head that somebody asked me earlier. Susie, another Susie, has asked me if there are any CBT for hypersomnia practitioners other than yourself in Australia. Some I think it was Melbourne, sorry, I can't remember.
In Melbourne,
or a good psychologist, I should say. I'm just reading it now.
Yeah, there's certainly sleep psychology centres around, often very heavily focused on insomnia, though, as you know. But some in Melbourne, I do know of, so I'd probably put you in touch with Hayley Meeklin, who's a psychologist completing. Is she someone you're familiar with, Michelle?
Yeah.
You've heard of her? She's probably
Hayley's lovely.
Yeah, she's probably who I would suggest that you track down, because even if she doesn't have capacity, I know she does work with people with hypersomnolence conditions, but she may or may not have capacity, but I'm sure she would then point you in the direction of her colleagues of who else she might recommend who's local.
Hi, Sarah. Susie here. My apologies to everybody, but I was a little bit late in and running Zoom from my bag on the sly. But Sarah, I will definitely catch up with the beginning that I missed afterwards. Questions for now. Do you have any advice on how to bring up or frame conversations about IH and its symptoms in the workplace?
Sorry, Susie, could you just repeat that one for me? I got distracted by the comments coming up.
Yeah, sure. And I'm just gonna search out a mic at the same time for me. So do you have any advice on how to frame conversations with your employer, your boss in the workplace regarding IH, you know, looking for positive outcome, positive conversations?
Yeah. I think it's, you know, it's tricky because every workplace is going to be a little bit different. Every employer is going to be a little bit different. But from a legislative standpoint, workplaces do have to provide reasonable accommodations for you to do your work. Just like if you had chronic pain, a reasonable accommodation might be a standing desk, for instance, or movement breaks and so on. So some workplaces are really great, others less so. But if they, you know, I guess what I'm saying is if it doesn't go so well, that's probably less about you. It's probably more about them. And that's where advocacy can be important. So when I have worked with people who've decided to take it to their employer and have a talk about it, usually we come at it from that perspective that just like, you know, anyone else who has a chronic health condition, you know, I want to be able to sort of have a talk to you about how I can be successful in my role. and what that might look like. So it's worth having a few ideas in mind already about the kinds of things that would be useful to you, whether that might be some days working from home, or whether that's, you know, having kind of periodic breaks, whether it's around reducing driving, if that's an aspect to your role, and so on. So I would kind of go in already having a bit of an idea of, so you can present it from a proactive standpoint that, you know, I have this condition, I want to be really successful in my job. Here's what I think we can do together to make that happen.
Yeah, look, that's really good advice. I think we know the condition in far more detail than any employer ever will, because let's face it, until we heard of it or were diagnosed ourselves, we wouldn't have known either. So going in with some suggestions and ideas armed with that is really good, rather than trying to have the workplace come up with things which, for a condition that maybe is more common, that might be okay, but perhaps not for us. Another question here, Sarah. Brain fog can be incredibly draining and challenging. Do you have any suggestions for combating brain fog in the moment, or is the best strategy to pause and wait until a better moment?
So brain fog is, you know, I sort of talked about that fluctuation. Often people can predict a little bit, and again, not all, I know I'm using generalizations, but can predict a little bit when they tend to be a bit more foggy. On first waking tends to be, for instance, an extremely common time with sort of that brain fog and sleep inertia, or after an effort, you know, cognitively effortful task. So if you can predict it a little bit, having a think about having some of those sort of energy boosting activities sort of pre and post that time. And certainly if you've got that brain fog and you've got the capacity to stand up, move, you know, kind of get away and have a bit of a stretch and a bit of a movement break, that's going to be more effective probably than trying to like grit your teeth and push through it. Sometimes you might be in the middle of a meeting, or, you know, maybe it's not possible to, you know, engage in anything in that moment. So if that's the, you know, some things that I might recommend in that circumstance might be jotting down a few notes. You know, if you need to perform in that moment, just sort of jotting down a few key ideas so that you can kind of parrot it back if you're called upon, for instance. Having a nice cold drink with you can be quite good. So that sets up a bit of a vasovagal response, which can be a bit alerting. And anchoring is what I call dropping anchor. So it's a bit of a mindfulness strategy that can be quite good in the moment. So what you would do, I might even just quickly take you through it if that's okay. So basically what we're going to use is our 5 senses to really quickly orientate and move the activity into our frontal lobes. So if you just, wherever you are at the moment, just notice your feet on the floor. Push your feet into the floor, give them a bit of a jiggle if you need to. Also notice your hands, so you could grip them, or you could feel the surface of the table. You could grip the steering wheel. Hopefully no one's driving right now, but noticing your hands and your feet. Roll back your shoulders and have a little bit of a look around you. Just notice about 5 things you can see. Notice their colour and texture and what they are. Also your hands and your feet, don't forget about them. Notice about 3 things you can hear. So there's my voice. Just identifying anything else in the environment you can pick up. Notice anything you can smell or taste, if there's anything. If there's not much, just being aware of the absence of it does the same job. So for instance, I'm not smelling much where I am right now, but dinner might be on in another room for you or something. And there's your hands and your feet, and there's my voice. And we're in this room and there's me on the screen. So in this moment, this is all the sensory input that's happening right now. It's quite tricky for your brain to do that, to notice all those sensations all in the one moment. And what it does is activate your medial prefrontal cortex, which sits right there between your eyebrows. When you activate that, it's going to pull blood and oxygen back into your frontal lobes, which means we can do some of the other things that our frontal lobes are good at, like communicating, being able to regulate emotion, being able to think a bit more clearly. So usually that takes like 5 seconds. It's not a long strategy, but it can be just one of those, if you really need to kind of, you know, pull it out in the moment, that can be something amongst a few other tools. So give that one a go.
It's good to add more to the kit bag of tools that us sleepies can grab onto. Sarah, another question here. One of the crew is looking to apply for a new job, and that new job involves some shift work. And they're asking, would it be reasonable, either in the interview or on the application, to say, you know, that shift work isn't really an option for them due to the effects that it has? What would your thoughts on that be?
It's tricky, isn't it? I think there's pros and cons at disclosing at the interview application stage. So kind of having a think about that from that perspective. And workplaces have to provide reasonable accommodations. So if the role requires shift work, and that's actually kind of a key part of the job description, then that's a bit trickier for a workplace to accommodate, if you see what I mean. That you know, if it's shift work that's kind of discretionary, like some people do, some people don't, well then of course you've got a bit more leverage then. So there might be some jobs, unfortunately, and I guess this is where the acceptance bit comes in, that just aren't realistic for you, and that really stinks. So you know, that you don't have to like that or want that, but there might be some things where you know, I just could not meet kind of the basic requirements of that role. If it is the kind of one where, yeah, it's kind of discretionary, some people do shift work, some people don't, and there's some I guess, you know, there's some leverage from that perspective, then absolutely I have advocated for people who are shift workers, for instance, but they tend to do better with an evening shift, for instance. So I'm not sure how much of this is the case for anyone here, but there tends to be more of a delayed sleep phase for people with hypersomnolence conditions than not. They tend to be a little bit better in the afternoon than kind of first thing in the morning. Again, not everyone. So, you know, when it's the case where we can, you know, we do have some choice and control in it, then yeah, you know, can we prioritise the afternoon shifts, for instance, because I'm there, you know, that's going to be really good for me. Whereas there's other people who are going to really like the morning shift, give that to them.
I have certainly had conversations with people who, you know, are in my group, and I put out very quickly that meeting with me in the morning, not going to be good. And one of my students really wanted 7 a.m. meetings, and I'm like, darling, you can, but I'm not going to be there. So let's negotiate this. And at least we came to a happy compromise there.
Yeah.
What else have I got here in the question list? Depression can be resistant to traditional treatments, CBT and medications. So do you think this also applies to IH? What's your experience with CBT and the response to IH? Is there any evidence?
So Jason Ong's sort of base CBT-H program that we've kind of refined did show improvements on mood measures, particularly with the CBT-H intervention. So we do know it can help. Whether it fully ameliorates the condition, as in, you know, we go from, you know, meeting criteria for depression and then not being depressed anymore, then, you know, that's a bit of a tricky one. But we know that we can, I guess, at least buffer it. We can improve some of the symptoms of it. Depressed mood is really common, of course, with the low energy sort of and hypersomnolence conditions. That makes sense, because a key thing that maintains mood is what we call behavioural activation, that capacity to engage in things with which give me reward, pleasure and socialisation. So if that's compromised in some way, mood very commonly comes down.
I apologise, I have a Navy jet going overhead.
Is that what it was?
Sorry.
Someone's enthusiastic with the housework.
Yeah, no, sorry, that is a very low-flying Navy jet, garrison town here. That's some really good advice. Does anybody have any other questions that they'd like to ask Sara directly, or we can obviously chat amongst ourselves afterwards as well? I'll actually ask one while everybody's thinking, and I do apologise because I did miss the beginning. But you know, RCTs, you know, take time, funding. Is there any? Do you have any funding to do this, or are you like most of us scientists? Cobbling it together the way that we usually do to do this research when numbers are low and it's hard to draw that grant money. Just kind of, yeah, thinking about where you guys are at with this, and yeah.
So at the moment we're cobbling it together. So we're trying to use some in-kind funding, just sort of parts of clinical practice. As a Queensland Health clinician, you know, part of our mandate is around quality improvement and research, which they expect us to try to do, you know, as part of the clinical role. So we will try to do that, but also probably for the RCT part, I think we will need funding, absolutely, to do that. So we will be applying for funding and trying to get that. There's the research that we're wanting to do is sort of a multi-centre trial. So we're collaborating with the Princess Alexandra Hospital here in Brisbane and the Woolcock in Sydney, which always helps in terms of getting enough of the population, you know, kind of having people being able to do the intervention, but also with attracting funding. There are some pockets of funding for sort of rare diseases and things. So look, we're not totally you know, demoralized about the prospect of trying to get something that will help it get off the ground.
I'm excited, and Sara, happy to chat offline with you about that too, as an IH person but also a researcher. So happy to kind of sit on both sides of the fence on this one. I think it's really interesting. One question has come in, and I'll do my best to paraphrase this one. Do you have any advice for coping with the juxtaposition, the dissonance, so to speak, of the personality you have, who you believe you are, happy, outgoing, energetic, versus who you are or who you become, or perhaps who the world sees you as, in the midst of your IH, full-blown, sleepy, fatigued, you know, struggling to engage with things? Yeah, the two different sides.
It's hard, isn't it? And at the beginning of the talk, sort of talked about sort of acceptance and those sort of paths, you know, kind of the resistant kind of refusing kind of path and the acceptance path. And the acceptance does not mean that you're happy about it or that you like it, but kind of what we want to focus on is, what is life like right now in this moment? What am I capable of right now? What's important to me and what do I prioritize right now? What are my values right now? So there's a grief and loss around that, right? So there's, you know, that there's parts of that definitely don't feel good. But I guess we're wanting to look at you know, what's the prospect for living the most rich, full and meaningful life I can in the context of who I am and what's happening right now.
It's such a difficult balance. I think we've all experienced that one. I'm multitasking on a tired brain, so you can see my cogs turning. Sarah, do you have any strategies for coping with, you know, the bad sleep inertia and the sleep drunkenness? I'd love to hear the answer to that too, having walked into walls, dislocated shoulders and falling into plaster. And yeah, I'd love any ideas you've got as well on that one. Good question.
Yeah, it's a tricky one, isn't it? It's a really common issue. Again, having a really consistent wake time as much as possible can just help from a circadian phase standpoint, that your body is kind of, at least can predict that it's meant to be coming out of kind of a sleepiness around the same time, getting lots of light. So going from quite dark to as much light as you can tolerate. Often people in that sort of inertia state kind of have a bit of sensory, you know, it can be hard to get lots of light. So try as much as you can tolerate, and you don't have to kind of burn your eyes out or anything. You know, if it's possible to kind of set up, so now we're just talking about if we slice up the day, if I focus on that first slice, is just about sort of basic movement, self-care, biological tasks, and how am I going to make that as easy as possible for myself? So do I kind of make sure that kind of access to the shower or getting dressed is kind of as impeded as least as possible? I don't have to go through too many steps or too many halls to get to where I need to. Is there anything I could do to make having a cup of tea and having my medication or whatever it is as easy and kind of accessible as possible? Some people benefit from taking medication a bit earlier, before the desired wake time. Something that's worth experimenting with. So sort of an hour and a half before the desired wake time, having a wake up alarm, and again, having it as easy as possible so that literally it's right there. You can just sort of roll over, toss it in and go straight back to sleep. And sometimes that can then help. So by the time the medication's kicking in, you're actually coming out of that sleep phase, and that can help. But I guess my key thing is you want to kind of minimize the barriers, make it as easy as possible, get as much sort of light as you can, and have really realistic expectations for what that portion is going to be. It's really just going to be about kind of wakefulness and survival. that first bit. So a 7 a.m. research meeting, no go at that time.
Yeah, no go for me. Absolutely. Sarah, that's been really fascinating. I'd love to talk to you more like on the research perspective, but let's not bore everybody else with that. But let me say thank you on behalf of Michelle and I and the whole group in IH, because I think any helpful tips and tricks that any of us can pick up to help make life a little easier or a little better, or just helping understand that we're all struggling with this and we need a kit bag of tools, which, you know, may or may not work at different times, but the more tools we have to choose from, the better off we are. So thank you so much.
You're welcome.
Yes, thank you, Sarah. Really appreciate it. Talk soon about that research.
Yeah, so we'll be in touch.
Yep.
All right, so I'll head off now so you can have your meeting.
Thank you.
Bye all.
Thanks so
See you
much,
later,
Sarah.
Sarah.
Cheers,
Thank
bye.
You. Yeah, okay, so whoever wants to hang around for our usual Living with IH catch up